So thank you for coming to this session. This is a hot topic because these standards that we have been updating were approved up by our council just 2 weeks ago. So this is one of the first sessions that I'm doing on this. And I'm hopefully haven't got too many slides because what I really want to do is actually hear from you with a bit of Q&A within the half hour I've been given. So our education standards set out how both nursing and midwifery programmes should be delivered so that it will ensure that the students who you are supervising and assessing will be able to meet the standards of proficiency for safe and effective practice. And we did update our standards, as you know, in 2019, but with leaving the EU, it gave us an opportunity to revisit them. And of course, some of the content of our standards have been underpinned by EU law. And in fact, the EU directive has been in place since the 1970s. And it really, when you actually read the language, you can see that it is very much dated. So we took the opportunity to review the standards. And what I think is important for you to know is that there is some divergence between nursing and midwifery. I'm not going to be talking about nursing today, but I will explain as we go through why we are adopting a much more cautious approach, actually, to any of the changes that we want to make. And it was interesting that our stakeholders were really anxious that if we went too far away from the EU directive, what will this mean for midwives who want to come into this country, but also, importantly, midwives that want to go and work in the EU and across the world. And at the time that we set the new standards, there was a lot of talk about whether we should have a 3 or a 4-year programme, and we know that we need to evaluate these new programmes now. All the students here today are on these new standards, and I'm sure you're meeting them in practice, seeing their new documentation. But I think it was very interesting that midwifery wanted to be more cautious while still wanting to sort of be more innovative at the same time. So this is just give you a flavour, really, of the fact that when we do our standards, we don't sort of go into a dark room and decide what we're going to do. We go through quite an extensive process. And you can see the timeline of this. It started in 2020, and we've now completed the final draft in 2023. But you may not actually see some of these things happening in practice until maybe even next year. It will depend really on the university you're working with, and I'll say a little bit more about that. But we needed to do a public consultation, and I hope some of you in the room did respond to that, because when we change our standards, we have to go out to the public to do it. And it was interesting that when you do those consultations, often you do get divergence between what midwives on the shop floor want, what educators want, and what the public want. And we have to balance all of those views when we decide to make any changes or not. So lots of engagement, including service users, the public consultation, and we had a steering group as well as a curriculum development group. And those people represented on that were people from heads of midwifery, researchers, academics, midwives, consultant midwives. And particularly in the curriculum development group, we made sure that all the 4 countries were represented. And that was really important because, as you can imagine, there's potentially different views between England, Scotland, Wales, Northern Ireland. So these are the key changes. So these are the things these are sort of your take-home messages to start sort of thinking about it. We've given the universities an opportunity to set more inclusive entry requirements. So the EU directive stipulated you had to have 12 years general education or an equivalent to enter a midwifery programme. And we were worried about that because that rules out potentially quite a lot of very suitable people who want to be midwives just because they haven't come through a traditional route. So the universities will be setting the entry requirements for the midwifery programmes. And We also moved where we had everything in an annex, all those skills, those 40 births, those 100 postnatal examinations, all the things that we've all done in the room, because this EU directive has been around for ages, and this is what we still expect the students to do. We've moved them into the proficiencies. So it makes much more sense when you read the proficiencies about what they've actually got to do. We've modernised the language, because the EU directive was quite elderly, and it gave us an opportunity to align that language with the standards of proficiency, which is, of course, were only published in 2019 and set on the Lancet framework, so we were able to align all of that. Now, we are keeping those skills. We are keeping those 40 births. We are keeping all those numbers that students have to count. And whilst as an educator, I don't know really whether 40 births makes a student midwife proficient to join our register and safe. It feels sort of right. It could be because I'm very familiar with it, and it sort of guarantees that students have to have a certain amount of time with women in labour and birth in order to gain those births. But we haven't got the evidence. And it's really interesting that around the world, many countries have actually adopted that same standard, and yet we still haven't got the evidence. So without the evidence, we felt we shouldn't change. And I think there is definitely more work to do. Because I think if we remove that standard, you as practice supervisors would have to really be very familiar with arranging more bespoke opportunities for students and being absolutely certain that they were proficient at the point of registration. And maybe we're not quite ready for that at the minute. So one to watch, I would say. And of course, we know that the EU are actually updating that directive. It's very slow in its fruition, but it'd be very interesting to see what they do in time when it's updated. One of the things we've also done, and this is a bit of my pet topic, if you like, is that we've changed the standard for the students caring for women in labour and then obviously caring for women who are actually giving birth. And we've combined them because we're beginning to hear that students are being pushed into rooms again to catch babies just to meet the numbers. And we don't want that to happen. We want them to give that continuity to women. So we've combined it. And it will be up to you to judge really how long they would need to be looking after a woman so that they can count that sort of experience. But we've tried to do that to benefit women so that students are not just rushing in to have the delivery when perhaps another student's been caring for them for many, many hours. And this is the one that probably is quite an interesting. We've took the opportunity to add an additional standard. So this is nothing to do with the EU directive. This is as much to do with Ockenden, of course, more recently Kirkup. So this additional standard is that we want students to gain experience of leadership and team working in different maternity providers. Now, what that will mean for you on the ground is that you will be potentially supervising students who may not have been with you for very long. So they may come for a short placement, they may come for a long placement, but you will see possibly more movement of students from the university than you may have done perhaps previously. We're not going to stipulate what we mean specifically by a maternity provider. We're not saying it's got to be a different trust, a different health board. You know, there could be a much broader definition, but the crux of it is that they gain experience of different ways of leading a maternity service and the different ways that team work, because we want them to recognise sound and good practice. So I think I've already said a lot of this, and the important thing for the births, we are actually going to be producing some supporting information because there's some interesting movement between how births are being counted, and we want to give some additional advice about that. And we've done that again with our stakeholders because we're concerned that some of the students are being signed off not having the 40 births, but having the 30-20 caveat, where that may not be right for the student. So we wanted to give some additional support so that you work much more individually. And for some students, they may need 50 births. For others, they gain that confidence and proficiency much sooner. So it's beginning to think about you as practice supervisors working much more individually with the student. And what I think is going to be really good when we can get the tech guys to sort this out is that when you read the standards, you'll be able to click on it and be able to go straight to the supporting information, because there's a whole host of supporting information about practice supervision and assessment, for example. But I bet if I did a straw poll, some of you won't have actually been able to see it. And I do admit that it is very hidden within, which is a great pity because a lot of work went into it to support you as supervisors and assessors. So actually being able to do it straight from the documents will be helpful. So I think the important thing for you as practice supervisors and assessors is to think about this modernisation of language. And I'm sure you're getting used to the MORA. I worked hard with others who drove this agenda to have this England plus Northern Ireland practice document. Scotland have got their own, Wales have got their own. And that was in a real desire to make things much more straightforward for you, particularly when you're getting students from different universities. You've got the same document, you know you're familiar with what it says. And of course they do reflect the standards of proficiency, and of course we all must be starting to use this language of the framework for quality maternal and newborn health. So if you don't do anything other than today but to take this take-home measure, we need to start talking about universal care that the midwife gives and the care that women need who have additional needs, but the role of the midwife throughout that continuum. It will take time because language like risk is very embedded, but it's very, very important. And what you'll find is that nothing has been really removed, but it has been maybe repositioned. So that's just to reassure you that this shouldn't make such a huge change other than that new standard I mentioned. So this is that standard. Gain experience of leadership and team working in different maternity providers. And it was very interesting in the consultation is that there was really strong agreement for this. They felt it was going to make a difference, but there was anxiety about how it would be operationalised, particularly if it meant that students were going to incur additional costs, if they were moving further away from their placement areas, and particularly in the remote and rural. If you vision now Scotland and people next maternity provider being 2-3 hours away. So we want to be flexible, and you'll find that between the universities it will vary, and it will vary for individual student midwives. So we would be expecting the university to talk through this with the students to make sure that we get it right for them. It will need to reflect their individual learning needs. So for example, if a student has done all their placements in maybe a more district hospital with a sort of a lower risk type caseload, it might be better for them to move to a tertiary unit or vice versa. Or if you're in London, it might be that you want to go to do an elective somewhere and you would be in a different maternity. So there's different ways of achieving this. But it will be counted as a placement. So we would envisage that any additional costs that the student has would be reimbursed. So I told you I was going to be fairly succinct because I really want to open it up to the floor. So thank you for listening.